Starches by Arnaiz and Valenzona. Our generic name is hetastarch or pentastarch. Our brand names include Hespan and Hestend and Pentaspan. Our chemical name is 2-hydroxyl ether starch. Our pregnancy category is C. Animal studies show risk and human studies are not available, or neither animal nor human studies were done. It is not known if it is distributed into breast milk. Etherified starches mechanism of action. We are a synthetic colloid volume expander that is used to maintain vascular volume in animals with circulatory shock. The pharmacokinetics of etherified starches are: etherified starches are administered via IV, distributed in blood plasma. For its metabolism, molecules larger than 50,000 in molecular weight are slowly enzymatically degraded into molecules that can be excreted. Speaking of excretion, 40% of molecules smaller than the 50,000 molecular weight are excreted in the urine. Within 24 hours, molecules that are hydroxylated are slowly degraded to glucose. Its IV onset and peak are immediate. Indications include hypovolemic shock. Since etherified starches are plasma volume expanders, they are used in the management of hypovolemic shock. Another is leukapheresis procedures. Hetastarch and pentastarch increase the erythrocyte sedimentation rate and added to whole blood. They are therefore used in leukapheresis procedures to increase the yield of granulocytes. Hetastarch and hextastarch have also been used in extracorporeal perfusion fluids. Contraindications: patients with severe heart failure, bleeding disorders such as hypofibrinogenemia or thrombocytopenia or renal failure. Special precautions include patients with hemorrhage, cardiac disease, liver disease, or renal impairment, patients at risk of developing pulmonary edema or heart failure. Side and adverse effects on blood: dilution of clotting factors and may also have direct effects on coagulation, coagulopathy, and hemorrhage. Serious complications such as intracranial bleeding and cerebral edema have reported in studies of patients with ischemic stroke and other brain injuries. And as you can see, do not be like Jon Snow. Effects on kidneys: oliguric acute renal failure and osmotic nephrosis-like lesions may occur. Effects on skin may include pruritus and persistent periocular swelling due to abnormal accumulation of hetastarch found in periocular tissues. It can also lead to hypersensitivity reactions, including anaphylactic reactions. Nursing considerations: nurses should consider monitoring urine output in patients that are intaking etherified starches. They should also monitor central venous pressure during the initial period of infusion to detect fluid overload. Avoid hematocrit concentration from falling below 25 to 30%. Monitor patient for signs of hypersensitivity reactions. To stop infusion if there are signs of oliguria or renal failure. Monitor for early signs of bleeding complications. Monitor electrolytes should only be used in children under expert supervision, and hetastarch is incompatible with many compounds, including a number of injectable antibacterials.
Oh my god!